So guys, this is my lecture on basics of biomechanics when we link this to the clinical practice. I have courses on this subject and both face-to-face courses and online courses also for this kind of treatment. Face-to-face courses I'm giving in some countries around the world. The next one will be in Egypt. So yeah, I think the majority, maybe the majority of the audience now is from Egypt and the surrounding area of Egypt. And on 9th to 11th of March, I'll be teaching this course. Of course, not just this course. This is just one hour and a half or maximum 2 hour lesson. And this is going to be a 3-day course with hands-on with the workshop. And this is going to be held in Cairo, and from 9th to 11th, as I told you, and is going to be on Holiday Inn Maadi, and this very beautiful place that I've been shown. And the class I'm teaching today, the class I'm giving you today, is based on that and on biomechanics and the biomechanics aspects of our daily practice. And what I always say, I always start with this screen here, my lectures, and I have to have an open mind to accept new information. Because if all you have is a hammer, everything in your life looks like a nail. So I don't believe in people that say, I always treat using aligners. Nowadays, I only treat with aligners, or those who say, I never treat with aligners, I treat just using conventional brackets, self-ligating brackets. And I don't believe that is good for your patient, for our patients. What I believe in is I need to have as much tools as I can in my toolbox so I can use whenever necessary that specific tool for my case, for my patient. So I understand everything about biomechanics, but I don't use what I want. I use what is needed in that specific case. That's why I start with this screen here, how to deal with different tools in my daily practice. When I think about finishing my cases, finishing strategies, in my cases, I always start with the diagnosis. That's it. So when I do my treatments, the first thing that I put that I need to take into consideration is the diagnosis, then the treatment planning, and from then I will apply the biomechanics in my daily practice. So today we will focus on some aspects of the basics of the clinical biomechanics. So we are doing this from now on, and we're just focusing on some aspects that you may understand, that you probably know everything about, which is the orthodontic forces that we use in our practice, the system of force that we use in our practice. A force is something that makes or tends to cause a change in the motion or shape of an object or body. In other words, force causes an object to accelerate or decelerate. It is something that we do in our practice, but we don't have like this. We have quasi-static system that we can apply some knowledge of this, the Newton's laws. And one is very important. The first law is very important. Most people say that the third law is important, but I think the first law is the most important thing from our perspective, from the biomechanics perspective. It is measured in newtons, but we use grams. But in orthodontics, it's almost always measured in grams. Force which is important for us. The magnitude, the direction, the point of application, the line of action of the force, and the sense that we are applying the force. So here it is. We have one force being applied in most of the cases in our crown, clinical crown. And because we are applying the force this way, we are generating a moment because, as we are going to see in a few slides ahead, we are applying the force at the level of the crown. And because of that, we are generating a different movement. If we don't want to have an inclination, we are having this type of movement because we are applying the force, one line of action of the force at the level of the crown. And if we don't want that to happen, we need to consider other things. So let's move on. We're applying the force, and then this force is going to generate something. The line of action of the force is one of the most important topics that we need to understand when we are applying a force to move a tooth or a group of teeth. Because from that line of action, we are generating the force that we want to eventually move the teeth, the group of teeth or a tooth, but understanding where that line of action or the resultant line of action of the force that we are applying, what's going to happen to that specific body, a tooth or a group of teeth. So we have one point of application that we just, that's what's going on. We have a point of application, we have the sense of the force, we have the line of action, and these characteristics, these features here are going to generate the movement that we want, or sometimes we don't want. But knowing what we want and applying the right line of action of the force will leave to the orthodontist, will give to the orthodontist the opportunity to do faster treatments and the correct way of doing the treatment. Point of application, line of action, and since we are applying the force most of the time far from the center of the gravity of the body that we are moving, of course, you know that regarding biomechanics, regarding orthodontics, we don't call it center of gravity, since that specific body is not free in space. Our tooth is not free in space, as we know. It is attached to the periodontal ligament, is attached to the bone, to the gingiva. So we know from researches that the center of, in this case, not gravity, the center of resistance of this specific body that we are moving is located at some point. We know that for one tooth, we have one specific center of resistance, and it will depend on some aspects. For example, the size of the root, the length of this root, and the shape of it, the bone attachment, the gingival attachment. So it will vary a little bit depending on this. In a single tooth with good periodontal condition, the center of resistance is located between the coronal third and the middle third of the root. And this is important because we are treating, in average, good periodontal attachment. And in this case, if we know the average position of the center of resistance, we will apply our system of force thinking about it, taking this into consideration. Of course, again, we know that when we have different shape, when you have root resorption, bone resorption, or some different attachment of the tooth, the bone to the tooth, we are going to change the center of resistance. We are going to change according to the position, the attachment of this tooth to the bone, to the periodontal ligament, and to the gingival attachment. So we are changing it. If, for example, we have periodontal loss, bone loss, we change the center of resistance, and it's going to migrate apically. And this is important for us, since we are applying the force further distant from the center of resistance, since it is going to migrate apically. And this is what's going to happen when we apply the force. Another aspect important here, if we are applying the force in a more inclined or less inclined tooth, depending on the line of action of the force that we're generating, if it is just vertical or oblique, we are changing also the relationship that we are generating between the movement that we are trying to have and the actual movement that we are having. Because everything is related to the line of action of the force and its relation to the center of resistance, okay? So what are the type, guys, as I told you before, we are just giving general view here of the biomechanics, as you know, and this biomechanics apply to the clinical daily practice. So I'm just focusing on some aspects that are going to be important for what we are doing today. What we are doing today is I'm going to take 3 specific points that are important for us. What are these specific points? When I apply just one line of action of the force, 1 point. When I apply a couple, 2nd point. And when I apply the line of action that I want to move the tooth or teeth, and the couple in the opposite sense of the moment generated by the line of action of the force. We are going to be more clear in a few slides ahead, but those 3 points are very important for us. Most of people that I know don't take too much, don't give too much attention to these points, but they are very important in our practice. Let me show that to you. One movement that we want in, I don't say majority of the cases, but in several cases, is a movement of translation. Is a type of movement called translation, meaning all the points of that specific body are going to translate, are going to move in the same direction, same sense, and same magnitude. It is good in most of the situations because when we do that, we are spreading the force along the periodontal ligament of our teeth, group of teeth, or specific tooth, if we're moving just one tooth. So this is good for us in many cases because we are not concentrating the force in the apex or close to the crown, because we are spreading the force, being this translation that we're applying, we're spreading the force through the periodontal ligament, meaning we are decreasing the magnitude of the force per unit of area. You know, this area now is not concentrating. It is spread, and the periodontal ligament is good for many cases that we use in our practice. But for the translation to take place, the line of action of the force needs to pass through the center of resistance. Of course, we know that the line of action of the force is an infinite vector. Infinite vector, meaning it goes backwards and forward, infinite. And we just know that this line of action of the force must be considered in relation to the center of resistance, but not just in a bidimensional view, but in a 3-dimensional view. We're going to reach this point very soon. So this is what we have when we apply the line of action of the force at the height of the center of resistance in this view here, a bidimensional view, a lateral view of the retraction of the central incisor. All points on a given body or a given object, in this case a tooth, move in the same direction and sense with the same magnitude, okay? This is the translation. But of course, you know that's not that simple, not that easy to achieve in real life, in our environment, meaning the mouth, meaning the face. So this is not simple, you know that, okay? Well, the line of action of the force may be applied to have translation, not just in this sense, but maybe oblique. Sometimes we apply this force, and sometimes we apply 2 lines of actions of the force to achieve the resultant force passing through the center of resistance. We're going to see this in a few slides ahead, in a few cases ahead. So we can sometimes have this type of movement, is a translation also, but it's not a translation, a distal translation of the center of this tooth. It is like an intrusive movement that we are applying here, can be a translation when we apply the correct line of action or the correct resultant of the line of action of the force. So now we are dealing with one force, one line of action of the force, okay? So The combination is more common. The combination between translation and rotation, those two movements, we're talking about rotation shortly. The rotation, the pure rotation, we just have when we have a couple. So let's move to the other most common mechanics, most common movement, which is the combination between the translation and rotation. The inclination. We're applying the line of action of the force far from the center of resistance, or not in the center of resistance, not passing through the center of resistance. So we're generating the movement of the body, but not in a translatory type of movement, but a tipping or inclination is going to take place. And in this case, we call it uncontrolled tipping, because we have the line of action of the force. I'm not focusing, of course, in the relationship between the force and the moment here, just thinking about one force passing approximately 10 millimeters far from the center of resistance. In this case, I'm having an uncontrolled tipping in which the crown is going palatal and the root is going buccal, and the apex will bear a very intense force concentrated in this apex, which may jeopardize the root by means of having root resorption because of the concentration of the force in the apex. Uncontrolled tipping is usually what we don't want in orthodontics. Let's say, for example, that we have that we are doing the distalization of the upper teeth by means of doing a force at the level of the crown, and we can't control. We are not controlling this movement, just applying the force. Let's say, for example, using a removable appliance with just one force at the level of the crown. This force that we are applying at the level of the crown, if we don't have another force in the system, is going to give us something like this. Crown is going one direction and root in the other direction, okay? And this is very bad in most of the cases. The center of rotation of this movement is located very close to the center of resistance, but a little bit more apical to it, okay? Moment is going to be generated. What is a moment, guys? What is a moment in orthodontics? A moment is a tendency of inclination. But for the moment to take place, we need to have the movement. Take that, please keep it in your mind. So we're going back to this concept further in our presentation, okay? Later in our presentation, I'm sorry. So this moment is going to be generated when we are applying the force far from the center of resistance, like this. The inclination is going to take place, the tipping is going to take place, and this moment here is what we call a clockwise moment. It's going to rotate a little bit of this tooth and translate this tooth also. So rotation plus translation is what we have in this type of movement, okay? Good, we know that, very good. So the moment is the tendency of tilting or inclining or rotating when a force is applied away from the center of resistance. And the magnitude of the moment, we know it is calculated by the multiplication of the force, and multiplying the force by the distance between the line of action of the force and the center of resistance. The distance must be perpendicular to the line of action, okay? So that's what's going to be in our daily practice. I'm applying the force at this level, let's say 100, 150 grams, whatever you want to apply, and we have between the line of action of the force and the center of resistance a distance. So if we measure this distance here perpendicular to the center or to the line of action in relation to the center of resistance, we are calculating the magnitude of the moment. Of course, you know from this view here that if the distance is further from this, far from the center of resistance, the line of action of the force, the moment will be a greater moment. So this is something important in periodontal patients, for example. Periodontally compromised teeth, for example. Let's do this math here. The moment is calculated, the force, let's say 150 grams of force, and the distance between this line of action and the center of resistance. In this example here, 1,500 grams per millimeter, which is what in orthodontics we apply as to measure the moment, okay? So this is what's going to happen. This is the center of rotation. And let's now move to the clinical view of this. What we see if we pay attention to social media, even to articles that we see published even in good journals, sometimes we see this kind of misunderstanding or misapplying the concept of the line of action of the force to have the right movement that we want. Sometimes we see something like this. Well, I want to close the gap. I want to close the diastema. And I know that when I apply, I know even by intuition that when I apply the force at the level of the crown, I'm not having, in most of the cases, a translation. I'm not closing the space like this. I'm closing the space like this. So by intuition, we think, wow, I've seen somewhere that if I apply the force, line of action of force, if we even know what a line of action of force is, if I apply a higher force, I may cancel it. And what I see is this. Well, in both directions, okay? Distalization or mesialization, closing or opening, we see this. People using this type of thing. And they're applying the force thinking that they're having something like this. It's not true. Of course it is not true. Why is that? Because the center of resistance is the same in the same position. It's away from the line of action of the force. Is far from the line of action of the force. So when we are applying this type of mechanics here, we're having two forces being summed, and those forces are not in opposite directions in relation to the center of resistance. So if we do that, if we want to apply two forces here, like one at the level of the bracket and the other one at the level of the bottom, we are having two forces being summed, which is not good. Too much force for that. Or let's say we're just applying this one here. Same thing, but less force, but again, away from the center of resistance. So sometimes we even see the vectors in the wrong direction, meaning that the intention of the orthodontist in that situation, I understand. They want to do this by translation, the translatory movement, but in fact, they're not having it. Why is that? Because the line of action of the force is still passing away from the center of resistance. So, of course, we have a less tendency of moment because it's closer to the center of resistance when we compare to this other distance here. Well, yes, it is, but still a moment. We're still having a moment. So this is not the right way to do. What is the best thing to do? What's the best strategy if I really want to have a translation in this type of movement? Not this mechanics, of course not, because it is still generating a moment. You see, first concept that we are applying today, the one line of action of the force. Yes, we can do that. Yes, it's easier sometimes. We are not thinking more than just applying one force and I'm trying to reach the right height so I have the movement that I want. But remember, you need to apply the force and to understand the system of force that you are generating. This is the simplest one. One line of action of the force being applied, trying to reach the center of resistance. We can do that. We can do that. Let's see. So if I want really to have it without this movement, of course, if we are doing this in like to close 1 millimeter, well, it won't make a difference at all. But if we are closing 4 millimeters, 5 millimeters, yes, it starts to make a difference. The movement is going to be completely different from what we need, from what we want. So if I want to apply the right concept for that, I need to have, look at this. So in greater distances, I have a very bad outcome, especially when I apply this in using light arch wires, not heavy arch wires, because a heavy arch wire will generate a couple, and a couple may resist a little bit to this type of inclination. Of course, if I have a thicker arch wire, I'm also generating more friction to the system. And sometimes I'll delay my treatment because of the friction, okay? So let's try to reach another type of movement. Let's try to use our knowledge here of applying just one line of action of the force at the right height. In this case, I can apply this using high hooks. I can make a high hook for that and attach this high hook. For example, I'm going to show you the clinical example of that. But let's say 1925 strip of wire, and I will make this loop with this shape. I'll make this hook with this shape and apply the line of action of the force at the center of resistance. This is the right way to do things if I want to have this translation. So you see that everything is attached, everything is linked. We need to understand the system of force that's being applied here. Of course, this is the simplest system of force. One line of action trying to reach the center of resistance. In this case, of two separate teeth, okay? I want to do this. Well, it's possible. It is possible to have in orthodontics. If I'm applying this, well, I can do something like this. This is an example of a case in which I close the space of two traumatized central incisor that I needed to extract, but I'm going to show you the case, how I did that, and then closing the space, closing the gap, closing the diastema, these two lateral incisors being closed, and the sense just to do this, okay? So this is the case, this is the clinical case, because my promise today was to apply the biomechanics to your clinical practice. So I'm trying to do that now. In this case, what happened? As you know, I like to do this. You probably know that. I like to do this. I like to show this cases tridimensionally, because for me, it's easier to see things. I'm sure that for you also, it's easier to see how things are going to be applied when we look like this, when we look to the image. So this is what I try to do. First of all, leveling and aligning the teeth. So running my sequence of arch wire, from which I'm not talking about today, but you can use the sequence you will apply in your daily practice. And then we are going to start one thing here. In this case, I wanted to do this low traction of upper teeth. And for this low traction of upper teeth, we also apply the biomechanics, the system of force. It's not something that we do like, well, what can we do? Let's just put here the bracket in a higher position and do the extrusion. No, there is a right protocol for that. It's not this. When we do that, we are not applying the right protocol for that. First of all, you need to apply the force at a specific activation per time. In this case, 0.5 millimeter each 15 days. In this case, I can do that using step, and step, not applying just the higher position of the bracket. Sometimes I can do that. Like in the end of our treatment, we can do that. At the end of our movement, we can do that, because like just for facilitating the process. But if you have a long distance to move your teeth, you need to understand what you're doing and you need to apply the right biomechanics. Let me show to you. And here we have it. I'm applying 0.5 millimeters each 15 days. Okay, so let's do it again. And of course, we need to adjust the height of the crown. And I'm doing the slow traction. Why is that? Because I want to, the bone to follow the movement. And for that, for the bone to follow the movement, I need, prior to the extrusion, the slow extrusion, the slow traction, I need to refer this patient to the periodontist, so the periodontist will clean everything, will apply what they do, and give me back this patient with periodontal health. I don't mean without bone loss, but periodontal health. And then we do that slowly, 0.5 millimeter. I start using the round arch wire for that, and I go very slowly. What's going to happen if I apply a high force? The movement probably will be the same. We'll have the bone following the movement, but not in the right magnitude that we want, okay? So we do that step by step, 0.5 millimeter at a time. And now I'm closing the gap, I'm closing the space like this, okay? And then I'm doing this. I'm doing the IPR, grinding the mesial and distal faces of those teeth, and closing the gap and closing the space. Of course, when we reach the right side, the exact size of the crown and the root, it won't help me if I do further IPR, because it won't close the gap, because the root is going to be wider than the crown. So I need to remove the root and go on doing the same thing, and I'm now trying to close the gap using the high force, line of action of the force for that, okay? Here we have it, and then we do our crowns. The case, and at some point, we lost a little bit of inclination, even doing the right thing. It's faster to have this downward movement than going forward. So it goes this way, and we need to adjust. Adjusting, and here we have at some point closing the space, and then extracting the remaining lateral, and then closing the gap. One line of action, you see, one line of action being applied at the center of resistance. So I had a good movement because of that. And here, closing, and here we have, still with the provisional crowns. This patient, unfortunately, didn't change the provisional crowns until today, because he doesn't have money for that. I treat this patient without cost for him because I wanted to do that for him. So here it is, before and after. And again, still applying one line of action of the force in a very common situation. I'm just picking some situations here. I can show to you what you can do if you want to apply this. One line of action, you need, if you want to do the translation, you need to understand in what height you're going to do this. So we're focusing now on individual movements. Let's see one situation in which I want to close the space, like in the remaining space of first lower molar losses. It's very common in Brazil. I bet in your country is also very common. So what we do for that? First of all, again, the periodontal status is important. So before doing the closing the gap, closing the space, I deal with the slow extrusion. So I make the bone follow the movement. So I make the bone follow the movement, and then I go very slowly in the mesial direction or distal direction, whatever is what I planned for. So first of all, uprighting the molar. How is the right way to upright the molar? There are several ways. I'm not focusing on that now. I usually use cantilevers or two-couple system, alpha and beta hook, loop for that. So depending on what I want. I want extrusion, I want just uprighting with the center of rotation at the center of resistance. What do I want? You see, guys, how important it is to understand biomechanics, because you can do everything you want in biomechanics. Of course, it's not like rocket science. It's not something that you take for granted. I do the calculation and everything is going the right way. It's not like that. Believe me, it's not like that. But we need to start at the right point. And then we focus in the right biomechanics. And we try to apply the right biomechanics at the whole movement, during the whole movement. And of course, we adjust. We adjust because the variables are enormous. We have several variables that we can't control. The height, the bone height, the root shape, the crown shape, and everything must be adjusted because of this huge amount of variables that we have in orthodontics. I see some professors doing like this. We need to do the calculation of everything, and we need, in a two-couple system, statically indeterminate system, we need to calculate everything, and statically determinate system, the same thing. We are starting at the right point, yes, but we can't control all the variables. It's not with us. It's not with us, okay? But again, let's move to the right, to the right planning for this. What I want here, uprighting the molar. First of all, uprighting the molar. And when I do that in a healthy environment, meaning I have, in this patient, a healthy periodontal apparatus, this is going to take place. Slow extrusion will make the bone follow the movement because the stretching of the periodontal fibers, and since we don't have inflammation there at this moment, we are going to have a good movement of the bone following the movement of the root. So this is what we want, and when we have it, something happened here, and when we have it, now we are going to close the gap. What if I want to apply one line of action of the force? We need to know where the center of resistance of one molar, two molars, or a set of teeth, where those center of resistance are located. And we have articles for that, okay? At the end of this presentation, you will have a QR code so you can photograph and have some articles in which this lesson, this course, this part of the course is based, okay? So now, from now on, I'm doing the movement. After a while, I'm doing the movement to close the gap. If I'm using one line of action of the force, I want that line of action of the force in the lower arch to be at the height of the center of resistance, which is located between the molar roots, 1 millimeter apical to the furcation. And this is what I'm aiming for. This is what I'm looking for, to pass the force at that height. So let's see something like, of course, it's not that easy because sometimes when you do a very high hook, in this case, this hook is welded to the molar. Of course, before bonding the tube, I welded this hook to the molar. And then I'm doing the movement to close the space using one line of action of the force, okay? And we'll have some examples when I use one line of action plus one moment, okay? So the moment to force ratio is very important in biomechanics. Of course, it's impossible for us to give a thorough class, a thorough information about this, but I'm going to show to you how we can control this. Here it is. What you're seeing here is at some point I'm doing the grinding of the wire. This is a 1925 stainless steel grinded in the posterior segment, so I decrease the friction, okay? And I'm applying the force at this height, closer to the center of resistance. And as you can see, we managed to close the gap, to close the remaining space. Okay, here it is. So do, first of all, uprighting molar, So we can follow. See here, let me show it again. What I wanted here was to give to the molar this uprighting position so the bone would follow the movement. And as you can see, the bone followed the movement. Here it is, and then we are closing the space. Look at this. The line of action of the force is very close to the center of resistance of this tooth. What is important here? Clinical tip. Don't do the activation plus activation and plus activation. Let the movement be slow. And why I'm doing this, first one molar, then the other one, because I try to do that several times using both molars, doing this at the same time, but it won't work properly. Most of the cases, it won't work properly. It will be very difficult for you to do that. So I do first molar, first one molar, in this case, the second molar, and in the majority of the cases, the last molar, in this case, the third molar, will follow the movement by the action of the transeptal fibers. I lost the English name for that. The transeptal fibers, okay? So they are stretched and pulling together with the second molar, the third molar, mesially, okay? So this is what we are going to see. And after a while, what's going on here? After a while, if the second molar, the last molar, won't follow the movement, we can help, okay? But in this case, as you can see, most of the movement was natural. Well, you are seeing now one view. And if I'm applying, again, remember, 3 topics. I'm just looking for the one line of action here. And I'm applying the line of action of the force, trying to close the gap, trying to close the space with a translatory movement of the molar. I'm applying the force at the height of the center of resistance. But I'm seeing just the lateral view of it. You need to see the center of resistance as a tridimensional structure. So for a multi-rooted tooth, the center of resistance is likely between the roots 1 or 2 millimeters apical to the furcation. But again, think of the center of resistance as a point that needs to be evaluated or assessed three-dimensionally. Three-dimensionally, meaning occlusal view, first order, lateral view, second order, or inclination, third order. So everything must be considered. And let's move back to that concept that we used before. This is the same thing for uni-rooted teeth, okay? Single-rooted teeth, same thing, but look at this. If I don't want, and I don't want, in the majority of the cases, the rotation of the molar during this movement, I need to apply, if I'm applying one line of action, buccal and lingual, I'm controlling the angulation with the lower position of the hook and controlling the rotation with this second force here. So I'm using just one line of action. Of course, this force here is being applied at the level of the crown and is generating inclination, meaning in the lateral view, it would be the angulation of the crown, but again, we need to adjust. We need to adjust. Let's see, regarding the rotation, what's going on? You see here, closing the gap. Okay, let's move it back. Closing the gap, and closing the gap. You see it? So we managed to have a good movement just using the concept of one line of action. And why Kleber is always talking about one line of action? Because we can use one line of action plus a moment, but not in this type of biomechanics. This is the simplest way to deal with it. Simplest way to deal with a simple biomechanics, okay? Clinical biomechanics, let's say. Here it is. before and after, occlusal view, a lateral view, and the radiographic assessment of this. And again, another example of one line of action of the force being applied, again, with one line of action of the force being applied in a simple movement. For example, intrusion. I want to intrude this central incisor because I want the zenith of these two central incisors to be at the same height. So I'm doing the intrusion. We know that, again, when you do extrusion or intrusion, of course, in a controllable manner, and with controllable force, with controlled forces, I'm making the gingival margin, the bone, I'm making them to follow the movement, okay? In this case, I want to do the intrusion. What if I'm applying just one line of action of the force? How can I do that? With round wires. With round wires, I apply one line of action without a couple. So what's going to take place when I do that? Just simple movements, so you can understand how important it is to understand everything concerning biomechanics. Now we have the gingival margins leveled, okay, and good alignment and leveling. But how could I manage this to do this type of movement? Well, let's move on and understand that. I'm applying the force at the level of the crown, the bracket. And depending on the inclination of the crown, I'll have more or less distance between the line of action of the force, which in this sense here, lateral view, is intrusive, okay? So I'm applying the line of action and generating the moment. The moment is this vector band and around the center of resistance, okay? So we have the moment of the force, which is going to generate a movement like this. If I'm doing that in one central incisor and the other central incisor, and they are lined up, they are the same line, what's going to happen when I do the intrusion? I'll have probably more relative intrusion than real intrusion, meaning I'll have in this very fast. So when we do the inclination of the crown, you know that I'll have not a real intrusion, but a relative intrusion. So I'll have this. I don't want that. Of course I don't, because those teeth, they were lined up. They were the same line before. So I don't want that to happen. What can I do if I'm applying just one line of action? Because I can do that by using rectangular arch wires and applying the torque. I'm jumping a little bit ahead here, but you know that. But if I'm using, for example, 018 arch wire, round arch wire for that, what's going to happen? How can I manage to control this? I will generate a resultant force passing through the center of resistance. Remember that I told that before in the beginning of our class? I can do that. I can combine two lines of actions of the force, so I can have a resultant line of action that is going through the center of resistance. So this is something that we can do. This is the trigonometrical way to see this. We can do the calculation by means of two vectors and the resultant and the moments generated. Same thing is going to happen, okay? So here it is, the way we do. I always start with a vertical band, and after the vertical band, I do the horizontal band. And everything must be very carefully evaluated, because we want to keep the line of the arch, the main arch, just having the band inwards and outwards, depending on what we want, and extrusive or intrusive plus horizontal bands, okay? In this case, inset plus intrusion band, okay? So now we have an intrusive force, virtually a real intrusion, because the line of action of the force is passing through the center of resistance, okay? So this is what we do using one resultant line of action of the force, okay? Again, another clinical example of that, doing the intrusion and intrusive bands for leveling, not leveling, actually, because we know that central incisors, they have a higher gingival margin in relation to their neighboring teeth, the lateral incisors. So we need to do that to increase the beauty of the smile. The smile is something that I pay a lot of attention, guys, because at the end of the day, what we sell for our patients, is a beautiful smile, is a beautiful face. It's not occlusion. The occlusion is a detail. The occlusion is a detail that we treat just to increase the beauty of the smile, okay? So now we have beautiful arrangement of the gingival margins, beautiful relationship because of this intrusive band. And again, you know that this intrusive band, when we do that using rectangular arch wires, we do that differently. I'm gonna show it to you soon. Here it is, gingival margins. And now we have a more pleasant smile because of this, okay? Well, let me ask you a question to see if you are paying enough attention. Is it always necessary a step in when we do intrusion bands? What do you think? Well, everything, just a tip, is related to the line of action of the force. If the line of action of the force is passing through the center of resistance, it won't be necessary because this line of action will not generate a moment. Remember, this is a translation. So in this case, if we have something, for example, like this, why are we applying with the intrusive band, a step-in band? It's not going to be necessary. Of course, you know that in this case, the opposite would be necessary, okay? The step-out band or a band towards buccal side, okay? And sometimes when we have this good inclination, even in this situation, sometimes you don't need to have another band. How is that possible? Well, something like this. When we do the lingual arch technique, we don't need to do that because the line of action of the force will coincide with the center of resistance in such situation. Of course, this is a specific situation, okay? So we need to think about the line of action and the distance between the line of action and the center of resistance. So we don't have cake recipes in orthodontics in most of the cases. Of course, sometimes we apply that concept, but in most of the cases, we must individualize our treatment by means of understanding the system of forces that we are applying to move teeth, okay? Understanding that, we will apply the right concept. Well, just making things a little bit more difficult. What if I need to do the retraction of a group of teeth, for example? We know that a group of teeth will present when they are tied together, but let's go deeper in this concept here. How can I consider that a group of teeth may be seen as a body, one body, just one body? Is this something that we consider when we have, for example, 1725 NITI, ligating the anterior segment? I'm applying the distal force. Can I consider that a body, one body being tied together, the 6 teeth at the same time being one body? No, we can't, because in this case here, because of the gap that we have inside the slot, the play that we have inside the slot, the force that we are applying there will make that set of teeth give different movements. Okay, so we are applying the force, we don't have the engagement, the complete engagement of the wire inside the slot. So we are just applying one force in one point, contacting one point without the couple. Even the couple, you don't have it at some part of the moment, at part of this moment, because we are just applying this type of movement. So for considering this group of teeth as having one center of resistance, look at this. We need to have a rigid ligation. Look at this. So this is something that we need to have. For example, 1925, okay, we can consider stainless steel if we have good contact points, or 2125. Yes, in the 2230 slot. In this case, you can consider that anterior teeth are together one body, and then we consider the center of resistance of this group of teeth together, okay? But sometimes we see that, mainly, of course, in the internet, in the social media, people using this concept in a wrong sense, like applying 1725 night-eye arch wire in a 2230 slot, and they're considering the center of resistance of that body together. But it's not true, because of the system is not completely rigid, okay? It's not rigid enough, so we can't consider that. Again, one line of action. I want to apply, Kleber, this concept of one line of action. And I don't want to think about torque. I don't want to think about the couple generated by the torque, meaning I don't want to even think about the moment to force ratio. I want to be simple. How can I do this? How can I retract anterior teeth without this need of controlling the torque or controlling with loops the moment of the loop for doing that? There is a way to do that. Yes, but of course, it's not mathematics. It's not something that we can establish as rigid. Always do like this, 10 millimeters, 8 millimeters, and I'm applying the force at that height, and everything is going to be perfect. It's not. It's not. Again, you need to individualize. But of course, we know that when we apply the average concept, in average will be okay. Everything's going to be okay. So let's go to the example. If I'm doing this, I'm applying the force, distal force to retract anterior teeth. I know that when I have a rigid ligation of anterior teeth from canine to canine, the center of resistance of those anterior teeth are approximately 8 millimeters high in relation to the center of the crowns. So if I'm applying this, I will insert my mini implant. In this case, it is necessary because I need control. I need good anchorage for this. So I'm applying the mini implant at approximately 8 millimeters high, and I'm putting the force in the hook very horizontal, completely horizontal in relation to the occlusal plane. But we have a tip here also. In this case, for having this outcome, I need to have a rigid ligation. So again, 1725 won't work. You lose inclination because of the plane side slot, and you're just pushing the teeth. So when you establish the couple, you start having a control, a type of control. Not that good, but we start having it. But if we want to have the control state established since the beginning, we need to have a more rigid ligation, which is, 21, 25 stainless steel arch wire inserted in a 22, 30, 30 slot. So we have a rigid control. And if you do this, you don't even need to ligate anterior and posterior segments. You are applying the line of action of the force, moving one body that the type of movement will be related to the center of resistance of that body. So now I'm moving the body distally using the line of action of the force passing through the center of resistance. So why do I need the ligation between anterior and posterior segment for that? We don't, because doing that, we are having more friction. So I want to avoid this friction here. Okay? No inclination, of course. Again, this is not mathematics. This is just average. Okay? In average, it will work. But if we need to adjust, we can adjust. We can change the line of action of the force. We can apply torque. We can control everything during the movement. Okay? Here it is, the situation, the clinical case. Okay, leveling and aligning. Look at this wire here. 21, 25. Look at the thickness of this arch wire. And here we have approximately 8 millimeters high. Line of action of the force, 8 millimeters high in relation to the center of the crowns. In this case, I'm doing 8 teeth together and then finishing with the loop that I use for losing anchorage. If you give me the pleasure to be with me in Cairo, I'm going to show all these loops to you. I'm sure this is something. There was a question about, it's very common actually to have this type of question, my friends. Someone asked me, Professor, do you think I'm just in the beginning of my career as an orthodontist, I'm finishing or the middle or the beginning of my program, post-graduation program? Do you think this is a course for me, this immersive course, 3-day course? Is it for me? What I say is, if I had the opportunity in the beginning of my career to see this when I was in my residency program, wow, my life, I promise you, would be much, much, much easier, because I had to struggle to learn that, having my problems, my mistakes, and trying to overcome those mistakes, understanding at the moment I was seeing those mistakes. So this is very important for me. You know, the most beautiful thing in my career is having the opportunity to do this that I'm doing now with you, that I'm doing when I travel. I have this passion for teaching, for seeing people. Wow, now I'm more relieved because I can do that. I've seen those cases going wrong, but now I know how to deal with it. And this is something that I really love to see in my students' face, my friends' face. Students, because now I'm in the position of being a professor, but I really, really love to teach people, to teach my friends the right way to do things. And this is something I'm blessed. I consider myself blessed because I have this opportunity. So I've been doing this, as I told you before, since the beginning of my practice in orthodontics. I was trying to find ways to overcome my problems. So back there in 2004, I started doing this a long time ago. Was just like 4 years of practice, and or more than that, a little bit more than that. I was seeing my cases going wrong, many difficulties, especially in periodontal losses, patients with periodontal losses. I was seeing those cases going wrong. And I started thinking, what can I do? Well, higher line of action of the force will help me, because in this case, if I'm not applying the line of action of the force at the level of the crown, I don't need to have a high torque to control the high moment generated by the force. Why is that? Because I'm passing the line of action of the force at the level of the center of resistance. You know, And I can't do that because nowadays, at that time, I was starting to work with mini implants. 2002, 2001, I was starting to work with mini implants. I have a book on that, a chapter of a book that I wrote in 2004 about the use of implants, mini plates in orthodontics at Anchorage. And I start seeing that, well, I don't need to apply a high torque if I don't have a moment. I don't generate a moment. And the way to do that is the thinking of one line of action passing close or through the center of resistance of anterior teeth. Because at that time, the only way to do that was using this concept here, using the high line of action. So I had two articles on which I did this. It's published in 2007, but yes, of course, I started doing that some years ago, and two articles showing the way to do this. And this is what I do. I apply a line of action of the force at a high position, at a high distance in relation to the center of the crown, so I'm not generating a moment, or at least a high moment. Because you understand that if I apply the line of action of the force at the level of the crown, I have to multiply the force I'm applying here by the distance between this point, this line of action, and the center of resistance of anterior teeth. In this case, a higher position of the center of resistance in relation to the center of the crown. Why? Because I'm dealing with periodontal compromised patients. And now I don't need to apply this torque, guys, because I can apply a high line of action on the force. Okay? So this is one case in which I treated this way. This is in the article. This case is shown in this article. Okay? And here we have it. Look at this. Unfortunately, I didn't have time to update this presentation here. Well, yes, you can see the outcome, even still with brackets in position. And here we have it. Look at this. Keeping the attachment, the bone attachment, and with a good control during the movement. Okay? Let's move on because we don't have time to delve in deeply in all the topics, unfortunately. Again, if you're given the opportunity to show to you this live face-to-face course, or you want to enroll in one of my courses, I can have the opportunity to show you in details this. But let's think about another concept here. What if I made this question several days ago in my WhatsApp group and then in Instagram? Which of these three options would be most suitable in this case? Look at this. I'm trying to depict here a situation in which I have excessive display of upper anterior teeth, and I want to do the retraction. And I have an open bite in this case, and I'm doing the retraction. Look how important it is to understand what we are doing. Those three examples here will give you three different outcomes. Why is that? Just because of what we've been talking until now. One line of action passing at some point in relation to the center of resistance, and I need to understand where the center of resistance is located. I think there's someone with the open mic. Please mute your mic, please. And so we have three different outcomes. I have here the retraction being made in anterior segment, the retraction of the entire arch at once, and the retraction. And since I know that I'm applying one line of action and generating a moment, I'm applying another line of action to control that. So I have three different situations. In this case, what I wanted is a little bit of retroinclination of anterior upper and lower teeth and doing the retraction and rotating the mandible in a counterclockwise sense. So, of course, we don't have time to detail this, but what is this here? I'm doing the retraction. Look at this, using 4 extraovular mini implants and giving a line of action. Oh, can someone help me here? I have one open mic that is interfering in the communication. Look at this. So we have it here, line of action of the force, doing the retraction of the entire arch, And since I'm applying the force, and now look at this, different from the previous situation, I have the line of action of, the center of resistance of the upper arch and the lower arch located between premolars, approximately 4 to 5 millimeters high in relation to the center of the crown. But for considering this, what do I need? You already know. I need a rigid ligation. If I have play inside the slots, this is completely different. I can't consider this the center of rotation of this body. The entire arch, I can't consider if I don't have a rigid ligation. So when I apply this concept, I use at minimum 1925 stainless steel with the proper couple being applied to secure the arch inside the slot. So what we have here, a line of action, moment. You see, completely different situation. Now I have intrusion of posterior and extrusion of anterior. If I apply like the previous example, extraction of the premolar and retraction of anterior teeth, I wouldn't have intrusion of posterior. I would just have the sliding mechanics and the moment being applied in this sense. Or if I apply the high line of action, no moment. But this is completely different. So you understand now that we need to see everything in orthodontics. Previous to the biomechanics, of course, the diagnosis, because from the diagnosis, I'm establishing what I want, okay? So here it is, and then now, and the force that applied here, the intrusive force allowed for the counterclockwise rotation of the mandible. And here is the case, and what I'm applying here, distal force both in upper and lower arches. And well, this is a detail, the mechanics, I usually use loops for that, but you can use the force, just one line of action, but this is the same concept here. Intrusion of posterior, extrusion of anterior, and now we have the bite being closed, and here we have 1 year after this. No, not 1 year, I'm sorry, less than a year, 1 year. Okay, let's move on to another clinical example of how biomechanics is important and how one line of action is important. Now I'm adding another thing, which is the control that I'm applying here comes from another moment, different from the moment of the force. How can I apply this? I'm using here now the intrusive force in the second upper molar, but now I'm using for that rectangular arch wire for doing the intrusion. If I'm doing the rectangular arch wire, now I have another thing. Now I don't have just one point of contact between the round wire and the slot, or 2 points, but without a couple. I'm having a square shape inserted in another square shape, the slot and the rectangular arch wire. So the relationship between those two square shapes will generate eventually during the movement a couple, 2 points of application of the force. And now I have like this, a couple, and I can do everything in advance. I apply the couple before even applying this intrusive force, and then I apply the intrusive force to have a more controlled intrusion. How is that going to happen? So I have a couple here, and the couple is generating a moment. And the moment of the couple, of course, if I apply the moment of the couple in the opposite sense in relation to the moment of the force, I'm canceling those two moments and I'm having a more intrusive force, net intrusive force, okay, being applied. Again, don't have time to explain everything. I'm just showing you examples of how biomechanics can be applied in a clinical way, okay? Here it is, a clinical situation in which I apply this. Intrusive force being applied by this loop. This is a leveling loop. It's not an auxiliary loop. This is a loop being made in the main arch wire. And in the tip of this loop, I'm applying the torque. So I'm having the intrusion. And of course, torque takes time. It's more common that we have a buccal inclination of the crown. And if we keep the torque, we'll have the torque being taking place eventually. Okay, not simple. This is how I do this. Look at this torque. Look at the torque, at the torsion here in the tip of this loop. And look what's going on. Wow, I need to rotate this wire when I insert inside the slot. So that's it. So now we have a couple. Now we're talking about something different. A couple. What is a couple? A couple is the concept of couple are two forces being applied in the same body with no collinear forces with the same magnitude and the same direction and different on opposite senses. Okay, remember the sense is the tip of the vector. Okay, the head of the vector. Here we have a couple being applied. In a couple, by definition, will generate a moment, and the moment of this couple is a free vector. Of course, again, we are not explaining everything, but believe me, this is what the concept says about the couple. The couple will generate a moment which is a free vector, meaning it can be moved anywhere on the body that you're applying this couple, and the same external effect will take place. What is this? What is this? So let's simplify things here. When I apply a couple, a pure couple, I have a pure rotation. When I apply a couple, the center of rotation of the movement will be the center of resistance of that body. So the couple will rotate that body around the center of resistance. This is the concept. But is this really true? When I apply a couple, will I always have the same outcome? And let me pass a little bit faster here, guys. We don't have time to think about it. But this is the concept. You need to believe me on that. So when I apply a couple, I'll have the center of resistance being the center of rotation. If I do the math here, I'll see that this is true, okay? But it will happen in a free body, free in space. But we are not applying this in a free body, free in space. Do you agree with me? No, we don't. So is that true that we have a pure rotation when I apply a couple? And I'm going to show to you the clinical importance of this. If I don't understand what I'm doing in orthodontics, I'll apply, for example, my sequence of arch wires, and I will reach the rectangular stainless steel, 1925, let's say. And I'm inserting inside the slot of anterior teeth. And I don't know how to read the couple. What's going on? What's taking place here? A question here. Do we really have pure rotation using continuous arch wire mechanics? Huh? No, we don't. Why not? Let's see. Well, here's the couple. We're generating an active relationship between the inclination of the slot and the inclination of the transverse section of the rectangular arch wire, generating an active couple. Couple is active, of course, and an active torque, let's say. So here it is. We have the couple. that is acting in a clockwise sense. A couple, as you saw before, it is a free vector. But is it going to take place, really take place? Is it going to happen this way? So note that rotation of the tooth or anterior teeth with the center of rotation located at the center of resistance requires that the crown to move downwards and distally, similar to a movement of a pendulum. Is it possible when we have all those teeth attached to the wire and the brackets, and we have a full arch wire attached to the brackets? Look at this. The crowns of anterior teeth are not free in space. So if we have the center of rotation being the center of resistance, I need to go downwards with the crown and distal with the crown. So is that possible? Being all teeth attached together, having contact points, and having a rigid arch wire, is it possible to have this type of movement? I don't think so, and probably you don't think either. So, in addition, we have to have this extrusion, and we can. The pendulum is like this, so it goes downwards and distally. So we have the center of rotation being the center of resistance. Not possible, not possible. So if you do like something like that, and you insert the rectangular arch wire with no torsion inside the slot of anterior teeth, what's going to happen? Not that. It's worse than that, actually. What's going to happen? We're having something like this because of the stiffness of the arch wire. We're having the center of rotation of this movement located close to the center of the crown of anterior teeth, close to the brackets of anterior teeth. Okay, so this is what is really going to take place. Do you want this? You may be thinking now, well, but sometimes I want to lose inclination of anterior teeth. Yes, you may have to do that, but not at this point of the mechanics. You need to do that in another part of the mechanics, because when we do that this way, the outcome is the same. I'm going forward with anterior teeth roots, which is very bad in most of the cases, especially in periodontal patients, especially in this situation. So this is very, very bad, okay? So remember, let's move it again. So this is an active torque when we have buccal, or when we have a proclination of anterior teeth, very common in periodontally compromised patients. And we are doing the leveling and alignment of anterior teeth, also posterior, but anterior teeth, the problem is bigger. So if I don't know how to read the torque, I'm going to have this outcome. Look at this. Look at this. So this is going to take place. Something like this. And guys, it's not the proper time to do the correction of inclination. Okay? And you have a class 2 to correct now. What's going to happen now? You lost further, you lost more attachment. You are doing now the second, you're having now the second problem of this. Now we need to retract upper teeth without losing further inclination, because I did a correction of inclination at the wrong moment. And now I have to do the retraction, keeping the inclination. How can we do that? How can we possibly do that? We can't. We can't. It's very difficult. Now we have less attachment. Now we have the center of rotation resistance is in a higher position because of further periodontal losses. So now we have the disastrous situation of trying to keep the inclination of anterior teeth in this very bad scenario. Okay? Very, very difficult. Believe me, if you don't know biomechanics, if you don't understand what you're doing, you are having this. So what can we do for avoiding this? We can apply the right concept. The right moment to do the correction of anterior teeth is during the retraction, because now the second scenario that I'm showing to you in this class, I have one moment, one line of action and one moment generated by that line of action, because I'm not applying this high line of action of the force, and I have a couple and the opposite sense, meaning if I balance those two moments, I can place the center of rotation of the movement wherever I want. Okay? Wherever I want. Again, not mathematics, but this is the concept. Okay? So first of all, I don't want to change the inclination. How can I do that? I will insert the rectangular arch wire without active torque. How can I do that? I make a torsion on the anterior segment, so when the rectangular arch wire is inserted inside the slot, it won't generate a couple because it has the same inclination of the slot, the same inclination as the slot, okay? And we don't have an active torque. And then you see no couple. There's no couple here. And there is no reason to change the inclination of the incisors at this point. You are just doing the leveling and alignment of the arches, okay? You're not trying to do the retraction. Now we are doing the retraction with a passive torque, 1925, the same, I always do the same way, 1925. Why is that? More stiffness and more possibility of controlling the movement, okay? Now we have reached the phase that we need to change the inclination, the retraction phase. So the moment of the force is being generated, and now we have the moment of the couple being generated inside the slot. So at some point, the moment of the couple is going to be generated, and it will counteract the moment of the force. And this relationship will change as a cycle, like a cycle. You have more inclination of the crown. Having more inclination, you're increasing the couple because because of the stiffness of the arch wire, it won't be changing its shape. So you're increasing the couple, and increasing the couple, you're correcting the root, and then you do more retraction. So it's a cycle. It's not something perfect like this. You go and change the inclination like magic. But that concept being applied the right way, it tends to give you the right movement that you want, okay? That's it. And here we have it. Oh, I'm not focusing on that now, but yes, look at this. This is the center of rotation of this movement, okay? It's not in the apex. It's not another thing that is wrong when you see the biomechanics in books. It's something that is wrong. It's not possible to be in the apex, because if you have the center of rotation right in the apex, you need to have extrusion because of the pendulum, okay? So this is completely wrong again. Well, okay. Articles and also in social media and everything. This thing here, this power chain connecting anterior teeth to posterior, just to change the inclination of anterior teeth. Based on what we are seeing now, the moment of the couple, the moment of the force, and the moment of the couple. What people usually want to do is something like this. I want to change, I reached the final steps of my mechanics, and now I want to do the correction of the inclination of anterior teeth. And I'm applying this. I showed this in one of my classes, and there was someone from South America that told me, but we've been applying that and it's working. It's working. And I asked, but it's biomechanically wrong. It's not possible to work this way. Otherwise you need to counteract to deny the physics. You need to deny what we've been teaching and what we've been learning for so long. Why is that? Look at this. If we want to do the correction of this, like this, with the power chain ligating this part touching here, if we don't have space like diastemas in the anterior segment, it won't change the inclination. Why is that? Because for changing the inclination using just one line of action of the force, remember, I told you before, we need to have the movement. The movement, it needs to take place. So you have the correction of the inclination. But you are not moving anterior teeth because you have contact points here. And you are not distalizing anterior teeth because you don't have another force. This force is this way, while the other force is this way. What's going to happen here? Nothing. How are you changing the inclination of anterior teeth if you are not moving anterior teeth backwards? You are not doing this. You can't do that. It's physically impossible to do that. So you're not having this. Actually, when we do that without space, we don't change the inclination. So you go to the article, according to Storino, the chain serves two functions. It detorques the incisor, it won't, during leveling, and it prevents incisor extruding during upright. It's impossible also. It's impossible because if you're doing uprighting, just doing this, you will have the extrusion of anterior tip of anterior teeth, of the tips of anterior teeth. It's not possible to happen in a different way, okay? So essentially, it provides a lingual crown tipping for force for bodily uprighting of incisors. It's impossible, okay? Why is that? Because of this. Because for having the moment is the tendency of tilting. The moment isn't present in the system until you have the movement. The moment is not there. The moment is going to take place while the movement of the crown is taking place. So if you're not distalizing the anterior crown, you are not having the moment. That's it, period. Simple like this, okay? So it's not possible. Well, but is there a way to do that? Is there a way to have something like this? This is the moment taking place, I told you before. Is there a way to correct the anterior teeth inclination? There is a way. There is a way. There is a way if you place the center of rotation of the movement in the bracket. But you can't do that. You can't do that applying one force. Remember, just one force being applied at the level of the crown will place the center of rotation of the movement close to the center of resistance. If there is a movement, if there is not a movement, nothing is going to take place. You're going to look and nothing is changing. And I'm going to show to you why people think that it is going to change. I'm going to show it to you soon. Let's move on. So there is a way to do that. Look at this. There is a way to do that. There is a way to do that when we transfer, when you position the center of rotation close to the bracket. But you can't do that using just one line of action of force. You already know how we can do that. We can do that. I showed you before using a couple. Remember, when you're using just a couple, you can place the center of resistance in the bracket. You have just a root movement, not a crown movement. Of course, we have to consider if we can or cannot do that based on the availability of bone buccal to the roots of anterior teeth, of course. I assume that you already know that. But when we want this thing to happen, we don't do that by means of using a power chain ligating in this position. It's not feasible, okay? Yes, our intuition tells us, well, maybe I'm pushing here, but you don't have space. You're not distalizing. You don't have a moment. You don't have a moment until you have the movement. So now, if I'm applying the torque I have, two vectors that will move one part and other part of the body, placing the center, in this case, the center of rotation close to the bracket. Why is that? Because of what I applied before. Stiffness of the arch wire, contact points, and you have sometimes a bonus here. A bonus, which is what we call the rowboat effect, but in this case, in the right direction, distal. Sometimes we use that to help us correct a class 2 situation, okay? So we can do that when we apply a couple, but we can't do that applying just one force, okay? Because for that, we would need to anterior teeth go inside the canine to go distal, and it's not possible, okay? So how can we do that? Again, applying the couple, and the couple is changing the inclination of anterior teeth, of anterior teeth by means of placing the center of rotation of the movement close to the bracket. So this is the only way to do that. Again, you need to evaluate if you have enough bone and to have bone availability here buccal to the roots of anterior teeth. If you have it and you want it, go for it. But if you don't have, just try to do this differently. And there is another way to do that. Why people think they are doing this? Because of this here. Look, when we do this, when we apply this mechanics here, it's not happening anything until you have the force. Now it will work, but not because of it, because of this line of action of the force. Just this, not this here. This here is just keeping anterior teeth together, as if you were using a steel ligature for that. Same thing. What is changing the inclination of anterior teeth is the distal force and the playing side as well. So completely different, guys, completely different. You're applying this concept this way. Look at this. And it works this way with inclination of anterior crown, okay? So this is completely different. So you understand, guys, how important it is to understand everything about biomechanics and to apply the right concepts in biomechanics so you can have faster treatments with better refinement when you finish your treatments. And you apply that concept of the biomechanics based on the diagnosis previously. So this is the magic of orthodontics. And it doesn't matter what type of appliance you're using. It doesn't matter if you're using aligners, if you're using fixed appliance, it doesn't matter. Why is that? Because the concepts are the same. Is it possible to do the retraction of anterior teeth with aligners, correcting the inclination at the same time of I'm retracting? No, it is not. It is not. And you need to prove me that it is possible. I prove you that it is not. And people say that it is possible. It is not. The mechanics you're using is good when you have huge inclination of anterior teeth. But try to show me one case in which you are having anterior teeth with good inclination and you have a huge overjet and you can do the retraction using a line. You don't have the couple. You don't have the moment of the couple, enough moment of the couple for that, okay? So if you want to know more about some aspects that we've been discussing today, you can go to this ebook that I'm giving to you. Probably many of you already have this ebook, but for those who don't have, so you can take a picture. Here is my Instagram. I usually keep posting videos of biomechanics, of diagnosis. Nowadays, I'm focusing on diagnosis, and there's a reason for that, because I truly believe that we can change people's mind about biomechanics, about devices. I'm not focusing on the occlusion. I'm focusing on the face, on the diagnosis that comes from Smile analysis, facial analysis, occlusal analysis also, of course, cephalometric analysis, and putting everything together to establish what's the best treatment planning, what the best treatment planning is for that specific case, and then applying the biomechanics for that, okay? So I believe that you can change a patient's face in the right direction, not negatively, but in a positive sense, and I'm applying these concepts, okay? So this is my Telegram group. You have some ebooks there also. If you want to join us, it will be my pleasure. And this is the gold. This is gold for you. Go to this. If you don't know much about biomechanics, start at this point here. Common Sense from Mulligan, very good way to understand clinical biomechanics. Clinical biomechanics, not abstract biomechanics. I love biomechanics. Since my early ages, since I was a kid, I loved to study physics, so I love biomechanics. But I understood that we need to teach biomechanics in a clinical way, not just about the sinal, cosinal, sinal, sine and cosine, and everything about the angles and the equilibrium. Of course, we need to know that. And me as a professor, I like to teach that to my students because I want to give them the power to decide what they want to do. But if I'm doing, like for example, now today, an explanation of biomechanics, I'm not using that. I'm using the clinical way to teach biomechanics because it's more important for you who are doing clinical things and not just my mechanics, just physics, okay? So I think you can do that using this step by step. And for finishing our presentation, I'm so sorry it took more than 1 hour and a half that I planned for, but I think it's okay. And I invite you, since I'm talking probably mainly for the audience so from Egypt and the area, the surrounding area, Middle East, I'm inviting you to be with us in this 3-day course on Cairo. This is going to be my second time visiting Cairo. I love the city. I love being there. I love the atmosphere. I love the reception that we have when we go to this beautiful city and the beautiful area of the Middle East. So I thank you all for being with me. I know that.
Thank you for today, Dr. Klepper. Thanks for the very informative webinar. And by the way, we love to have you here.
Okay. I love to be there with you. Right? It will be a very good opportunity to meet you in person and to meet all my friends from Egypt.
Sure.
I really love your country. I really love Egypt.
Thank you. Thank you for today's webinar. It was very informative, amazing animations, great explanations.
Thank you very much. Let me just, before we finish, let me just see if we have some questions. Thank you, Professor. Thank you very much for that. Please, guys, if you tag me on Instagram or Facebook, and please give me feedback for what you thought about our today's webinar. I will be very, very satisfied, and I'll have the opportunity to follow you back. And if you do that for me, it will be very good. I appreciate it, okay? So we love to thank you so much for, okay, thank you, again. Thank you all for the beautiful, it's always perfect to be with you. What about retracting normal inclined upper teeth with aligners using pressure points? Okay, it won't work at all. If you do that using the concept that they teach us to do, if you do the power reads for that, actually you are decreasing the contact points. You have just 2 points, and you are applying in one of those points close to the margin, that you are cutting your aligner, it's weaker. So you don't have enough force at that part. So I don't like to do that. I think it's worthless. Okay, I think it's nothing that you can control. Okay, let's move to another question. Can we use round wire to retract to correct inclination anterior using power chains and class 2 elastics? Well, I can't say that you can't do that at all, because there are some situations in which you can't do that. For example, we have not much of overjet, not a big overjet, little overjet. And I want to do the correction of anterior teeth, the inclination of anterior teeth. I can't do that with round wires, knowing that the round wire won't allow me to control the inclination. The inclination will be an uncontrolled tipping, but sometimes I want that to happen, to take place, like this, okay? But if you have a big overjet and you have good inclination of anterior teeth, and you need to retract anterior teeth, keeping the inclination, you never, ever do that using round wires. Please, it's going to be very bad for your patients, okay? Okay, thank you again. Thank you again. So the link for Telegram, again, here it is. The Telegram group is here, okay? So you have more, just take a picture and you have more ebooks there, including this ebook, Rectangular Arch Wire, which I consider one of the magics of orthodontics, dealing with continuous arch wire, and knowing how to deal with the rectangular arch wire will be gold for you, okay? Would you kindly help us get the link for the previous record? Well, actually, you need to contact David. David is a Portuguese guy, very good guy, on his Telegram group. It's called Ortho. His Telegram group is, I'm gonna give you here, okay, Simply Ortho. I'm sorry for that. Simply Ortho, you kill me. But you know, it's already late here now in Brazil, so I think I'm a little bit tired. I'm not remembering everything. Do you put tabs or intrazygomatic in the case you showed with open bite and elastics? Yes, yes, IZCs and buccal shell. Yes, and I think there's one case in which I used mini plates instead of mini screws, okay? But same thing, same concept, just one option, one different option, okay? So guys, I think we can go to sleep. Again, thank you very much for being with me.
Thank you so much.
Thank you for the invitation. I hope to meeting you soon in Egypt. In less than 1 month, I'll be there, okay?
Sure, thank. I will come to you soon. Thank you and good night. Have a good, lovely night. And sorry for any inconvenience for today.
No, it was perfect. I love to do that. As I told here, I love to give classes. So thank you very much. I'm now finishing our presentation. So hope to see you soon in Egypt or wherever we can meet. Okay. Bye, guys.
Bye.